Let's do some fertility math. The survival rate of frozen eggs is usually about 80 to 95%. Then the fertilization rate of frozen eggs, which by the way has to be done with ICSI, fertilization rate is usually about 70 to 80%. Then from fertilization rate, pregnancy rate from vitrified eggs is very similar to those from fresh eggs, but those success rate vary significantly and it really depends on age. Hi, superhumans. I'm Dr. Mavis Garcia.
And I'm Dr. Wise.
We're two of the physician leaders at Markham Fertility Center, otherwise known as Our Baby, MFC.
As fertility specialists, we've witnessed firsthand the challenges, triumphs, and the myriad of emotions that come with trying to conceive. Whether you're just starting to think about having a baby, actively trying, or facing challenges along the way, My Fertility Podcast will be your go-to resource for honest conversations and a supportive community.
So grab a cup of coffee or tea and settle in, and let's demystify the world of fertility together. Welcome back to My Fertility Podcast. Today we have an exciting episode for you. We are going to be diving into the world of egg freezing. We're going to talk about what is egg freezing, who should consider it, and we're also going to share with you some sobering facts about egg freezing. Egg freezing has become a huge topic of discussion in social media, and there seems to be all kinds of different school of thoughts about it.
Yeah. I think that it's worthwhile to address them at this point. And hopefully by the end of the episode, we'll give a really evidence-based, solid, and balanced view of egg freezing.
I like the word balance because, this is not going to be an episode where we tell you everybody should freeze their eggs and it's the best thing in the world. We really want to make sure that we dive into the evidence and give you the facts so that you can make a decision that works for you based on accurate scientific information. One of the things that I hear on social media is this concept of it's wrong to freeze your eggs and that women should be actually supported to have children earlier in their lives with social support and childcare support and career support so that everybody can have children before they're 35 and they don't need to worry about the impacts on their career and their lives, and that way egg freezing wouldn't be necessary.
For the record, we totally agree with the sentiment that women should absolutely have the supports and everything to be able to be mothers when they are younger, and then better social services, better accessibility to daycare, maternity leave, being supported, and a more cultural acceptance of, people putting their families first potentially and going on mat leave. We totally support that. We totally believe in it. However,
yeah, 100%. However, at the end of the day, it's a question of choice. And the last thing that I would want to see is a woman saying to me, hey, I'm 32. Yes, I have all the supports because society is amazing and we've evolved to the point where I can do this. I just don't want to. I don't feel ready. And I would like to freeze my eggs so that I have the ability to have children later in life, regardless of the supports that are available. Because let's be real, having a child it's a lot of work. Even if you have free daycare and you have maternity leave benefits and a supportive work environment and thriving career and, God forbid, partner who is a real partner who is equally sharing in the duties of the house, there's still a lot of work in raising a child. And a lot of women may not be ready to do that when they're younger, even if they have access to those resources.
yeah, honestly, for so many couples nowadays are doing this whole DINK thing, right? The dual income, no kids lifestyle, traveling, restaurants and all that. And that's really gaining a lot of traction on social media too. So even if you offer them free childcare, I don't think that's the thing that's going to make them have kids sooner rather than later.
And having said that, actually, in preparation for this episode, I came across an interesting study that looked at the reasons women were trying to freeze their eggs. And it's not because of career, and it's not because they don't have the ability to have free childcare, and it's not because they're enjoying the DINK lifestyle so much. It's because they can't find partners when they are in their early 30s, partners that they want to share their life with, that they want to have children with. So they are realizing that they don't have a partner. They do have this dream of having children with the ideal partner, and they're freezing their eggs so that they have the opportunity in the future when they're able to do that.
Yeah, absolutely. And I think COVID, pandemic, lockdowns, and all that really made that worse, I would venture to say, and really left people with several years where there wasn't that same level of socialization and dating and all that. Kind of put everyone back a few years.
Another thing that I've seen in social media in terms of criticizing egg freezing is this idea that fertility clinics and society in general shouldn't be talking about egg freezing so much. They should actually be spending time and resources in educating women and men about the impact of lifestyle on fertility rather than talk about egg freezing. And to be honest, I couldn't agree more.
Absolutely. I think it's so important that people appreciate that lifestyle is so crucial when it comes to fertility and general health for that matter. So when we're talking about lifestyle, we're talking about diet, we're talking about exercise habits, we're talking about weight, we're talking about whether people are smoking, vaping, how much alcohol they're consuming, recreational drug use, environmental exposures as well. And I agree. I agree totally. I think that's also a really, really important thing that people should be educated on, and that more specifically that this can affect your fertility down the line.
Yeah. And to that note, we have episodes 6 and 7, which goes over lifestyle factors for both men and women. And this is something that all people should know, not just the women who are actively trying to conceive right now, or the men who are actively in a relationship trying to conceive or going through IVF. It's anyone who says, okay, I know that having a family is part of what I want in my future. I'm in my late 20s, early 30s. Whether you're freezing your eggs or not, this is something that you should be aware of so that you can live a life that support those goals whenever they happen to be for you. So I would certainly agree with that. However, while lifestyle factors is really important, there is an undeniable truth, which is that fertility declines with age. And it declines with age for every single one of us, regardless of how well we treat our bodies and regardless of our lifestyle. What lifestyle can do is make that decline perhaps a little bit less steep, but the decline is going to happen anyways. And we're actually going to talk about some statistics on that.
And you know what? I would also kind of argue that I think that a lot of people know smoking is bad and that consuming lots of alcohol is bad and that we should eat more fruits and vegetables. There is a very big gap between knowing what we should do, knowing what we should eat, and actually doing it.
Yeah. And at the end of the day, it's not an or nothing. Just because you have the ability to freeze your eggs doesn't mean that you should let your lifestyle go. Just because you have the ability to have the resources to have a child in your 32 doesn't mean you might want to. So just like you were saying at the beginning, it's not an either or, it's all of the things are true. Yes, we should have resources. Yes, we should work on our lifestyle. And yes, you should be educated and have the option to freeze your eggs if you're not ready to conceive in your early 30s.
And I think I even said it on one of our lifestyle episodes. I think I said lifestyle is one piece of the puzzle in the world of fertility, right? And I still really love that analogy because it goes to show you that it's an important piece of fertility, but it's not the be all and end all. And again, aging is still important. Genetics still plays a huge role in terms of egg quality, egg number, sperm quality. And it's like a lot of things in the world of health, right? You can live the healthiest lifestyle. You can go be running a marathon and you could have a heart attack, or you could have high blood pressure, high cholesterol because of genetics. Or you could be the lifelong smoker that never gets lung cancer. And that's a big role of genetics. So lifestyle is super important, but you can't place everything on lifestyle or depend solely on lifestyle to get you to where you want to go.
Exactly. And another thing that I see in social media, and my God, I should get off social media.
Are you doom scrolling in bed at night?
Yes. Okay, I don't smoke, I don't do drugs, I don't drink alcohol, but that is one habit that I have that I confess it's really bad for you and I can't stop it. Actually, one of the things that I see in social media a lot is this concept that fertility clinics are causing fear mongering, that fertility clinics are scaring women into forcing them to do IVF or doing egg freezing with all this talk about age and fertility decline, and that it's not true and that people can have babies at any age. And of course, it's always going to be comments like, I had a baby when I was 43. I didn't even have any problems conceiving at 45. I had a cousin or a friend who had 3 kids between 40 and 45. And of course, the stories are all out there. But we have to give you the facts. I mean, that's what we're here for. You can make your decision for yourself. So we are going to go over some of the statistics when it comes to the impact of age and fertility.
Yeah, you know what? This is one that I really struggle with and that I really grapple with when I'm talking to patients, because on one hand, you want people to know and to understand and to have the truth. But at the same time, I don't want my patients to be scared, right? That's not the goal of any conversation that we have. But I think people need to go into things with eyes wide open. And there is so much evidence and literature and studies to show that age by far is the biggest predictor of success when it comes to either conceiving naturally or if you're doing IUI or IVF. And I tell my patients, I wish I could guarantee higher pregnancy rates in women over 40, for instance. Like, I wish I could give them that. But I know that myself, other fertility doctors, fertility practice in general, we just can't. We're still limited by the age of the eggs. Now, yes, you could have a pregnancy at any age to some extent, but that might involve donor egg, donor sperm, surrogacy, which is often not what people are thinking about or expecting, or what people are imagining when they're thinking about their own fertility journeys.
Yeah, it's usually the people who are saying that this is fear mongering are not fertility doctors. They are people who are actually not physicians at all. And I dare anyone to sit with me in an office and have to look at a person in the eyes when she's 40 years old and hearing this for the first time, having complete shocked and being like, I had no idea. No one told me this before. And what I commonly hear, which is, I wish I would have known. I wish I would have known.
Yeah.
So that's what we're trying to do here, is we're trying to educate and give you the facts and then empower you with the information, not so that you are afraid and run to the fertility clinic, but just so that you are not caught years later with the feeling of, I wish I would have known.
Yeah, absolutely. It's a delicate balance for sure, trying to portray these two ideas.
Okay, so let's get into it. Women are born with the number of eggs they're ever going to have. And unlike sperm cells, hair cells, skin cells, females do not make new eggs throughout their lives. Rather, the total number of eggs is determined when a female is in utero, has a fetus at about 20 weeks of gestational age. So at 20 weeks of fetal development, a female fetus has approximately 6 to 7 million eggs in utero.
And when we're talking about this number, it's probably genetically determined as well. I'm sure that there are some people who start with a higher number of eggs and some people who start with a lower number of eggs as well. At 20 weeks of gestation, there's 6 to 7 million eggs. Then, by the time a female is born, that number has already decreased to about 1 to 2 million.
From birth to puberty, this number continues to decline, and approximately 300,000 to 500,000 eggs remain by the time a girl reaches puberty. And then throughout the reproductive years, about 1,000 eggs are lost every month. That doesn't mean you are ovulating 1,000 eggs. You're actually only ovulating one egg. And even if we were doing IVF, we're not going to be getting 1,000 eggs per cycle. We're mostly getting between 10 to 15 eggs per cycle. But through the process of atresia, about 1,000 eggs every month are being lost in the ovary, and only one is mature or released in every menstrual cycle.
By the time a woman is 30 years of age, she probably has about 100,000 eggs remaining. And by the time she's 35, the number now drops to 25,000. By 40, a woman has approximately 10,000 eggs left.
And by the time a woman reaches menopause, which is typically around age 50 or 52, there are only a few hundred eggs that remain. And these are usually poor quality, and you're not ovulating. That's why women are not having a period after menopause. You're not responding to stimulation either through the external gonadotropins that one we use in IVF or the internal endogenous production of gonadotropins. That's why there's no periods, even though you technically might have some few hundred eggs left in the ovaries.
That's wild, though. Can I just say, the rate of decline of eggs is absolutely boggles my mind sometimes.
It is. And also it's wild that there are still, 10,000 eggs at age 40, that sounds like a really good number when you only need one to make a baby.
Yes.
But in reality, it's not a good number because of the fact that you cannot stimulate all of the eggs, because of the quality of the eggs, because of how many eggs you're getting in a stimulation cycles. It's deceiving because without knowing what I know, I would be like 10,000 and I only need one. I'm golden.
I agree. We see it day in and day out in our practice. That's not necessarily enough all the time. We might run an AMH blood test or an anti-Mullerian hormone blood test, let's say in a woman at age 40, and we see that the AMH is low, and we will often call it decreased ovarian reserve or DOR, despite there being these 10,000 eggs. And so we see it in practice all the time when we're running these AMHs.
Now, we've talked about egg quantity, giving you these numbers, but we haven't talked about egg quality, which also really declines with age. And there is no actual test that we can do for egg quality, but we can give you the data of the live birth rate per egg retrieval based on age, which is another way of talking about egg quality. This data comes from the SAR data, which is the Society of Assisted Reproductive Technology, which is looking at all IVF cycles in the United States. So per one egg retrieval, which includes all the transfers, for some people that could be one transfer, for other people that could be multiple transfers. If you are under 35 years of age, the chances of a live birth per one egg retrieval is 41.3%.
If you're between the ages of 35 and 37, that drops to about 30%.
And if you are between 38 and 40, it drops even more to 18.2%. Then by age 41 and 42, it drops by half, which is 9.1%. And by age 42 over, the chances of a live birth per one egg retrieval is an astoundingly low 3.1%.
Wow, that's pretty low.
Mm-hmm.
I mean, we see it in practice for sure. We see those numbers,
but it's still shocking to see it. Yeah.
Exactly. I think that's what's really striking, I think worth noting, is that there is a huge difference between 41 and 43 when there isn't much of a difference between 31 and 33. That is something that's really worth noting and worth mentioning, that it is that kind of that logarithmic curve, right? The differences over 40, even every 6 months, we see a difference in terms of outcomes. And it does drop off really quickly once you're getting into those late 30s, early 40s.
So back to egg freezing is an attempt to stopping the clock. Now, it doesn't stop the clock for the ovaries. The ovaries will continue to go through the natural aging process after egg freezing, but it stops the clock on the group of eggs that you retrieve from the ovary in one egg freezing cycle. Those eggs are what we call vitrify, which is a really fast freezing method, and they will not continue to age while they're frozen. Now, egg freezing is not a perfect solution and it's not an answer for everyone. So we are going to talk a little bit more about the nuance of egg freezing in this episode and who should consider it and who it's not really ideal for.
To start with, how does the process of egg freezing actually work? What are the nuts and bolts here? So first thing is, if a person is interested in egg freezing or getting more information about egg freezing, it would start with an assessment by your fertility specialist. We want to know about your current ovarian reserve, right? Where are you falling in the line of the dropping of the eggs, both based on age, but then also based on specific testing that we do. We want to know about your general health status, whether that could have an impact on eggs or the procedure. And we want to know also about your ovaries and where they are, how accessible they are during an egg retrieval procedure, and whether there's any other gynecologic issues or gynecologic things to think about. And then I always will talk to patients as well about what their plans are, what their goals are, what their hopes are for the future. And again, I've talked to some patients and they have no idea if they want to have kids or when they want to have kids. And that is totally fine. But at least I think it's good to have that discussion so that if they are telling me that they want to have kids in the next 6 months, but they're 31, then I might dissuade them from egg freezing, for instance. So that's another really important part of the discussion.
Yes, you're right. That conversation is crucial because we will use all of this information to plan your protocol and counsel you on the expected number of eggs that will be retrieved and the expected number of eggs that you need for your goals. And we're going to talk about that later.
Once that is all done and we've got our cycle planned and you know what you're doing with your medications and everything, We're actually ready to start the stimulation cycle. Stimulation medications typically start on day 2 of your menstrual cycle. Now, technically, they can be started anytime in the menstrual cycle if this is an urgent egg freezing type situation. But generally speaking, I think most people, most clinics, us for sure, we will typically start on day 2 of the cycle if we're doing those injections. People will take injection medications on a daily basis. And yes, you're going to have to give yourself injections for anywhere from 10 to 14 days. During this time, you're going to be coming in for cycle monitoring appointments. So this is blood work and ultrasound appointments that typically happen early in the morning so that we can see what are the medications doing to your ovaries and specifically how many follicles are growing, how big are they, what are your hormone levels like, how are you feeling, how are you doing, do you have questions, concerns. From there, once most of the follicles in the ovary, we have a nice sized cohort measuring area from 1.7 to 2.0, 2.1 centimeters in size. You get a different medication, which we call the trigger. You can check out IVF episode 14, where we talk about different triggers. But this trigger medication will sort of kickstart that final maturation process so that the eggs get ready to be retrieved. So they actually detach from the follicle and they're floating around so we can retrieve them. From the time of the trigger, about 36 hours later, we are actually doing the procedure, the egg retrieval.
Market fertility, this is done with anesthesia present, so our patients are well sedated and very comfortable during the procedure. That same day after the procedure is completed, you'll know how many eggs were retrieved and how many were mature and frozen for future use. After that, you'll have a follow-up appointment with your fertility doctor where we talk about the final outcome of the procedure and how does that fit into your overall goals, which goes into whether or not you need to do another egg retrieval procedure to collect more eggs.
So that basically concludes one full cycle of egg freezing. Most fertility clinics, I would say, offer egg freezing, although the experience of the clinic, how they do it, may vary. It's worth it to have a discussion with your fertility specialist in clinic as you're going through this procedure so that you're super comfortable with the process.
Egg freezing became a hot topic of conversation in social media when Jennifer Aniston said in her famous interview for Allure magazine, I quote, "I would have given anything if someone had said to me, freeze your eggs, do yourself a favor, just don't think about it."
The truth is that Jennifer Aniston probably really didn't have that option. I mean, we don't know the exact timelines and how everything kind of went down with her, but egg freezing didn't really become a thing until early 2000 when the technique of vitrification became standard practice. So prior to vitrification, which is basically how we freeze the eggs used to be frozen by something called slow freezing, which was really bad. They did not do well. They did not survive. So here's the thing about an egg. An egg is one cell and they're big, right? Like they are massively large compared to the sperm. It's actually kind of crazy when you see it under the microscope. In fact, eggs are one of the only cells in the human body that you can actually see with the naked eye if you have good vision. But eggs are mostly water. And what happens when you freeze water? It expands. The slow freezing would cause ice crystals to form, would cause the water to expand, and then the eggs would just sort of fall apart and get destroyed. And so the survival rates for freezing and thawing eggs were extremely low. When vitrification came around, it was a very fast freezing process where it's a very rapid cooling that happens so that the water crystallizes immediately and then they don't expand in that same way and the eggs do much better.
It was actually not until 2012 when the American Society of Reproductive Medicine declared the procedure of egg freezing no longer experimental, and the International Federation of Fertility Society called egg freezing one of the most significant recent advancements in assisted reproductive technology. So I don't think this was an option for Jennifer Aniston, but that article was incredible. I remember the gossip at the time about she looked so amazing and she had such a successful career. I remember the gossip at the time was Jennifer Aniston doesn't want to have kids. She cares so much about her body. She cares about her career.
Yeah.
And that's the reason that she keeps getting divorced, which it was gossip. It was a lie. It was terrible. And it's another misogynistic lie to put down women who are successful.
Yeah, and it's so hurtful. And I mean, I think it just then goes to show you again that there are lots of women out there who may be experiencing fertility issues, trying to sort out their fertility. And all of these things can be going on in the background, and you can have no idea when you see them. And why the power of your words is so, so important to recognize and to keep in mind before you say things.
For sure. Back to egg freezing. Is it safe? The answer is yes, it is. We did a prior episode on IVF risk, and the risks of egg freezing are very similar to that. We did a deep dive into the safety of the stimulation medication and the safety of the egg retrieval, and that would 100% apply to egg freezing because the stimulation and the egg retrieval is the same for an IVF as it is for an egg freezing. To summarize that here, there is extensive research showing no increased risk in ovarian cancer, breast cancer, or any other type of cancer with the ovarian stimulation. Those are the hormones that you need to produce eggs. Also, the egg retrieval procedure itself is very safe. And when it's done by experienced physicians, the complication rate is less than 1%. Another common question here about egg freezing is, would it cause menopause? Or would it affect my chances of getting pregnant naturally after I freeze my eggs? Or will I mess my menstrual cycle? And the answer to that is no. It does not do any of those things. It does not cause menopause at all. It would not impact your ability to get pregnant naturally. We're going to talk about that more in this episode. But we actually encourage you, even if you froze your eggs in your 30s, we do encourage you still to try and get pregnant naturally. That would be the best outcome. And then egg freezing would be a backup resort. And would it interfere with the menstrual cycles? With the cycle that you're doing your egg freezing, you're not going to get your period exactly the same time you would have gotten it in that cycle if you were not doing an egg freezing protocol. But after everything is completed and you do get your period after freezing your eggs, after that, the next menstrual cycles will go back to whatever pattern you have beforehand. That could be a regular pattern, or it could be an irregular pattern if that was what was going on prior to freezing your eggs.
Another big thing to consider when someone is contemplating freezing their eggs is, what about the babies that are born from frozen eggs? Are there particular health issues or complications that can happen to these babies? Which, again, we know a little bit about from the IVF literature, but this is a little bit different in terms of freezing eggs. There was this really cool study that was published in 2013 in our favorite journal, Fertility and Sterility. In the study, 855 women. They underwent a IVF or egg freezing type stimulation and retrieval. Then they froze some of the eggs and thawed them. And then they did some where they went ahead and made embryos. And they were actually able to do a direct comparison in pregnancy rates between eggs that were frozen and then eventually thawed and made into embryos versus if you got the eggs fresh and proceeded to make embryos with them right away. And so they followed pregnancies right up until delivery. And then they looked at also neonatal data 28 days after delivery. This was a really good study because it really looked at pregnancy outcomes, live birth outcomes, which obviously is the most important thing that we always really want to know about. The cool thing is in this study, they found no significant differences between the use of fresh and frozen eggs when they were looking at the rate of things like an ectopic pregnancy, or when they were looking at the rate of certain fetal anomalies or birth defects, either that led to somebody terminating a pregnancy or major anomalies at birth. And that was a powerful study that really showed that babies that come from frozen eggs versus fresh eggs do equally well.
So who should consider freezing their eggs? Well, this is a discussion that anyone at any age can have with a fertility specialist. And this is what we're here for, to counsel you, to explain the rest, to explain what is the expected success rate based on your age. That consultation and the investigations, most of them are covered by OHIP if you live in Ontario. Now, the ideal age to freeze your eggs is between age 25 and 35 years of age. Freezing after 37 years of age can be successful, but you will need a lot more eggs for a live birth than how many eggs you need if you're under 37 years of age. Needing more eggs means that you might need to do a higher number of egg retrieval procedures in order to get that many eggs, in order to have the same live birth that you would have if you only have 10 eggs and you're under 35 years of age.
It's important to note that we do egg freezing in older patients, and it can sometimes be done in an urgent situation. Eggs can be frozen urgently for people who are about to undergo chemotherapy for cancer treatment or treatments that might significantly impact their egg reserve. Like, let's say someone's going to have both of their ovaries removed because of concerns about some sort of cyst or something like that. And so we will do those types of egg freezing cycles on women even outside of these age parameters. But that's because we know that they're about to do something that's going to have a significant negative impact on their fertility. Freezing any eggs gives people an option or leaves the door open for some type of fertility down the line. But we generally don't recommend freezing eggs in older women.
So the million-dollar question is, how many eggs do I need to make a healthy baby?
That's more than $1 billion question. I'd say it's $1 billion question. But there's a couple of considerations, right, when we're thinking about freezing eggs. Number one, the eggs have to thaw, right? So that is a potential risk about how many eggs will thaw out. And then they have to fertilize. They have to get together with sperm to actually fertilize. And then they have to make it to embryo. Then it has to lead to a successful pregnancy as well. So there's several hurdles if you want to think about it. I mean, Olympics are coming up. So now I'm thinking all about the summer sports analogies. But I think of IVF or egg freezing as like a track with hurdles. And each of these hurdles are really tall that your eggs have to go through, right?
So let's do some fertility math. The survival rate of frozen eggs is usually about 80 to 95%. Then the fertilization rate of frozen eggs, which by the way, has to be done with ICSI. ICSI is when you take a sperm and put it directly inside the egg. And we talk about that in episode 14. Fertilization rate is usually about 70 to 80%. Then from fertilization rate, pregnancy rate from vitrified eggs is very similar to those from fresh eggs, but those success rate vary significantly and it really depends on age. For example, let's say a woman under 35 years of age wants to freeze her eggs and we retrieve about 10 eggs in an egg freezing cycle. Given a survival rate of 85 to 90%, once you thaw those 10 eggs, maybe she has 8 eggs that survive the thaw. And given the fertilization rate of 70%, about 6 to 7 eggs that survive the thaw would fertilize. So now we're going from 10 to 8 to 6 to 7 eggs. Now, the blastulation rate is usually about half of the number of eggs that fertilize. So from 6 to 7 eggs, maybe about 3 to 4 develop into blastocysts. And then the rate of genetically normal embryos when you're under 35 years of age is approximately 50 to 60%. So if you have 3 to 4 embryos that are blastocysts under 35 years of age, about 1 or 2 or maybe 3 would be genetically normal, leading to approximately a 55 to a 60% chance of live birth when you're under 35 and you started with 10 eggs frozen.
Let's do some math with slightly different numbers. Let's say we have a woman who is now age 40. Let's say that there are 20 eggs retrieved. If a woman who's 40 has 20 eggs that are retrieved, if we apply those same numbers, we would assume that anywhere from 16 to 18 eggs might survive the thaw. From there, maybe 11 to 14 eggs will fertilize, and then 4 to 7 might develop into blasts. 1 to 2 blasts may implant, and then there may be 1 live birth resulting from those 20 eggs. Now, this is the key point, though. In this, we talk about 20 eggs in a woman at age 40 versus 10 eggs in a woman at age 35. So the egg number, the number of eggs that we have to start with, really drives outcome and drives success rate. And that is why women who are older need more eggs to be able to get those similar pregnancy rates.
It's also important to know that women who are older might also have lower ovarian reserves. So it would be very difficult to get 20 eggs in one egg-free cycle from a 40-year-old woman. Well, I think it would be fairly feasible to get 10 eggs in one egg freezing cycle from a woman under 35 years of age. A woman who's 40 may need to do maybe 2, 3, 4 egg-free cycles in order to collect 20 eggs to have the same chance of live birth that a woman under 35 would have with under 10 eggs.
Another caveat to all of this. In this example, we've applied the same survival, the thaw rate for eggs, but we know that as women's eggs are older, the quality is poor. And so they may not survive at the same rate as eggs that are younger. blast rate may also be lower in women who are older and who have poorer quality eggs. So even though we apply the same percentages, it may end up being lower.
Another thing is that the rate of chromosomally normal embryos at age 40, it's much lower than the rate of chromosomally normal embryos at age under 35. So to give you an example, a woman under 35 years of age might have about 50% of her embryos be normal. But a woman who is 41 to 42 years of age might only have about 15% of those embryos be chromosomally normal. And that number drops to 5% for women over 42. So this is some of the reasons why older women need more eggs to have a reasonable expectation of live birth. And more eggs equals many more retrievals when you're older, which might not be feasible for many women.
One thing that I hear a lot is egg freezing a fertility quote unquote insurance policy? And you know what? We hate that term.
We do. On behalf of every fertility specialist in the world, I would say we do not like that term.
This is, in a way, an insurance policy, I guess, because it gives people an option to use younger eggs and to have that kind of backup plan that's not otherwise possible. But the key word is that it might work. It's an option. It's more like a plan B. It's not necessarily a guarantee of a live birth just because you froze your eggs. Because the eggs are frozen as eggs, there's still this huge question mark about how well the eggs will survive the thaw, how well your eggs will fertilize, how well they turn into blasts. Are those blasts going to be genetically normal? Are those blasts going to stick to the uterus, That's why there really isn't that guarantee, that kind of connotation that comes with the word insurance policy, and that's really important to know. So freezing eggs is not an insurance policy, but maybe it's the backup plan of maybe another backup plan. First thing is potentially no spontaneous pregnancy, maybe. Second backup plan might be fertility treatments, but this could be like plan F. How about that?
Yeah.
F for freezing.
Yeah. And the younger you are when you freeze your eggs, and the more eggs you have, the closer you are to being, quote unquote, an insurance policy.
Exactly.
Because the higher your chances of live birth.
Absolutely.
Another question that comes up frequently, and if it doesn't come up, I bring it up when I talk to my patients, is the question of, should I freeze my eggs or should I freeze embryos? And that question is loaded, so let's talk about it. Technically speaking, freezing embryos is better because embryos are closer to a baby than eggs are. So embryos is egg and sperm. We take the eggs, fertilize it, grow it to blastocysts, ideally do genetically testing on them. If a woman goes through this process and at the end of the process, she has, let's say, 3 to 4 genetically normal embryos frozen, we can very confidently say there is a very good expectation of live birth if you have 3 to 4 genetically normal embryos frozen. Every genetically normal embryo has approximately a 55 to 60% chance of live birth. If you have 3 genetically normal embryos frozen, there is a very good expectation of live birth. Definitely having frozen embryos is ideal. Sometimes I get couples that are together, they want to have children together, they just don't want to do it right now. And the question comes, I want to freeze my eggs. And then we have the conversation that if sperm is available, you certainly can freeze embryos, and that would give you much better chances of live birth than an egg, because like we said, the egg has to go through all of this process in order to become an embryo and to become a baby. However, the main problem is the obvious problem, which is when you use sperm to make embryos, now you're bound to that sperm. And when you do this job long enough, you see patients that come after having done IVF with their partners, and it's now 5 years later and they're older, and they are full of regret and upset because they now have to discard these beautiful embryos they created because even they're no longer together. And now that's it. They cannot make new embryos because they're older, or they cannot freeze their eggs because they're older. So always something to keep in mind, that the problem with making embryos is that you are bound to the sperm that you made the embryos with. If you made them with a partner, then that partner has to consent to the use of those embryos in the future. Most people, when they're no longer together, that's where the issue comes. So you're not going to be able to use them. If you made them with donor sperm, then you can use them anytime in the future without any further consent from the sperm provider. But the issue becomes there that you might meet somebody in the future that you want to have children with. And if all that you did was freeze embryos with donor sperm, then that option may not be available to you in the future. I would say for women who are under 35 years of age that have good ovarian reserve and they don't have a partner presently, or they do have a partner actually, I would say it's very reasonable to freeze your eggs and not have to worry about using sperm. In the ideal world, you would do one cycle for egg freezing and one cycle to make embryos if you do have a partner at the time that you're meeting me, but wanting to have children in the future. For women who are older than 35 years of age, 36, 37, then I think it's worth having that conversation about whether or not you will be willing to use donor sperm, even as a backup plan. Hey, I'm going to make embryos with donor sperm. I'm going to leave them in the frozen, and I'm going to try still to go and meet somebody with the understanding that this person that I'm going to meet needs to be okay with the fact that I might want to conceive a child with the donor sperm that I used in the past. Using donor sperm is a big deal, and many women are just not ready to do that when they're coming to see me for egg freezing, and I completely respect that. So sometimes, even though we have that conversation, they still don't want to do it, and then we go ahead and do the egg freezing. Like I said, it's all about option, and it's all about understanding what your odds are.
It's also worth to note that the cost of doing an IVF cycle and making embryos is higher than the cost of an egg freezing cycle. Cost can come into play. And then if you're doing IVF and now you're adding donor sperm, the costs go up even more. And so I think that's another really important point. Another thing that I'll sometimes throw out as a potential idea is to do a cycle, but then maybe if somebody has good egg reserve, especially maybe to split so that somebody freezes half the eggs and then uses half of those eggs that are retrieved to make embryos. So that can be a more cost-effective way to have embryos and to have eggs frozen. But when you're splitting a cycle, you're going to have lower numbers for each, and therefore that chance of success might be lower. There's no guarantee that you're going to have good embryos and good eggs, but it's definitely a consideration.
Yeah, remember how we talked that it's all about the number of eggs that you start with because they need to thaw, fertilize, develop into blastocysts, and develop into babies. So if you normally have 20 eggs, but you just use 10 of them to make embryos, now you went through the whole egg freezing process and now you only have 10 eggs. And if in the future you're not wanting to use those embryos because they're made with donor sperm or a partner that you're no longer with, now you just decrease your chances by having less frozen eggs than you would otherwise.
We sort of alluded to costs here, and I think that that's another important consideration because egg freezing is often an elective procedure, meaning people are opting to do this. One cycle of egg freezing here at MFC as of spring of 2024 is about $9,000, and this includes ultrasounds, blood work, and all procedures. We also have to consider the cost of medications, which can vary widely depending on what dose of medications you need based on your egg reserve and how long the stimulation is. That could be anywhere from $3,000 to $4,000. It's important to check with your insurance company if you have any kind of insurance coverage to see if they may cover fertility medications. And then there's actually increasing number of employers who are now adding egg freezing and other fertility treatments as part of their employee retention strategies. There may be some benefits there.
All right, so we've covered a lot of things, but I want to do a 1-minute summary of this episode, okay?
Mm-hmm.
Time me, 1 minute. All right, so egg freezing, is it safe?
Yes.
Would it impact my natural fertility?
No.
Is it really an insurance policy for my fertility?
No, there's no such thing as an insurance policy for fertility.
Talk to your doctor, be informed of your choices. It works best in women under 36 years of age. The more eggs you have, the better your chances it will result in a live birth. But talk to your doctor about your specific situation. You've got this.
One last note, we did an episode on lifestyle factors for women. Regardless of your age, whether or not you froze your eggs or going to freeze your eggs, whether you're trying or not trying, there are things that you can do to optimize your fertility as much as you can, and being mindful of lifestyle factors is important. You can check out that episode number 6.
I want to leave you with a quote from the Jennifer Aniston article that I referenced earlier on in this episode, because I think it really summarizes certainly our sentiment as fertility specialists helping women with building their families and their fertility, and also some of the comments and the criticism of the fertility industry into whether or not this is adding pressure to women's life. The quote from Jennifer Aniston: "We are complete with or without a mate, with or without a child. We get to decide for ourselves what is beautiful when it comes to our bodies. That decision is ours and ours alone. Let's make that decision for ourselves and for the young women in this world who look up to us as examples. Let's make that decision consciously, outside of the tabloid noise. We don't need to be married or mothers to be complete. We get to determine our own happily ever after for ourselves."
And that's a wrap for today, Superhumans.
If you're looking to connect, get social with us. Follow us on YouTube and Instagram at My Fertility Podcast, or visit us online at myconfertility.com. And don't forget, follow, subscribe, and share your favorite episode.
Thanks for listening to My Fertility Podcast and for being a vital part of our community. We know you've got this.
We're signing off until next Tuesday.
If you found this episode of My Fertility Podcast helpful, please take a moment to head over to the review section and leave us your thoughts. Your reviews and comments are incredibly valuable to us and help guide future episodes. We also welcome you to direct your questions to info@myfertilitypodcast.com.
My Fertility Podcast is produced by Rabbit Media Inc. in conjunction with Dr. Garcia and Dr. Weiss. Music from Mix Kit Raising Me Higher by Ajay Stelino. My Fertility Podcast is not intended to replace any type or variation thereof professional medical, health, or legal advice, nor should the content be taken as medical advice. Please contact your primary healthcare professional regarding any medical questions you may have. The information presented in this podcast is based on the knowledge and understanding of the host at the time of recording. Medical knowledge is constantly evolving, and new research may change the understanding of health-related topics. While we strive to provide accurate and up-to-date information, we do not guarantee the completeness, accuracy, or timeliness of the content. The views expressed in this podcast by guests are not those of the host or the management. This podcast is not intended to impose any type of discrimination. My Fertility Podcast and its management are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast.